Marvy, why do these environment welfare advocates say there's been a surge in medical waste?
Jovic, due to the coronavirus pandemic, with hundreds of thousands of masks now being manufactured every day, conservation experts have flagged environmental and biosecurity concerns about where these masks will inevitably end up. On July 22, when face masks were announced to be mandatory in COVID-19 hotspot postcodes in the state of Victoria, sales skyrocketed by 480% in just 24 hours. According to the Victorian government website, 23 million single-use masks have been ordered by the state, and more than 1.5 million have already been distributed to hospitals, schools, and public housing. When suddenly there is a population of 20 million Australians in the eastern states wearing 1 to 2 masks per day, the amount of waste generated is going to be substantial. It may not be natural to consider the environmental impacts of face masks and other personal protective equipment or PPE in the midst of the pandemic, but experts say that attention must be paid to an environmental problem that will far exceed that of the virus and affect generations to come. While these face masks are indispensable to protect the health of Australians, they are often disposable and non-recyclable. Australia Marine Conservation Society plastic spokesperson Shane Coco said that the nationwide uptake of PPE has been critical for our health and safety, but it is bad news for ocean wildlife. With little information on how to recycle or dispose of these new plastic products, these plastics are likely to be ending up in our oceans alongside the tide of other single-use plastics already threatening animal lives. Given that surgical masks are supposed to be worn for no longer than 1 day, their disposal, along with that of empty hand sanitizer bottles, soiled tissue papers, and PPE, is leading to a massive trail of clinical waste in the environment. Jovic?
Well, Marvy, based on these observations, what do these environmentalists propose to the Australian government to respond to this concern?
Jovic, environmentalists suggest that the government to create general awareness of these problems and biohazard protocols. They also suggest prompting people to embrace reusable masks over single-use ones and swap use of latex gloves with manual hand hygiene practices like frequent hand washing. Jovic?
Also, Marvy, could you give us an update on the latest count of COVID-19 cases there? We know that Victoria is really hard hit by this pandemic. Are there stricter measures for residents and travelers alike?
Jovic, today Victoria has recorded 278 new cases of COVID-19 and sadly 8 deaths, down from the record-breaking daily toll of 725 cases from last week. For people living in metropolitan Melbourne, Stage 4 restrictions currently apply. A curfew is in place between the hours of 8 p.m. until 5 a.m. This means residents must be at their homes during these hours. The only reasons to leave home between 8 p.m. and 5 a.m. will be work, medical care, and caregiving. As for traveling, residents can only travel up to 5 kilometers from their homes. Also, only one person per household can leave home to get necessary goods and services. So far, these are the updates implemented to slow the spread of coronavirus by reducing the number of people leaving their homes and moving around Victoria. Jovic?
Thank you, Marvy. You stay safe in Australia.